Nice to have you join us on this week's episode of Health Business. Our mandate on this program is to bring you health information that makes you live a more healthier life. My name is Oluwatoyin Kolawole. Sit down, relax, and enjoy this package. Welcome back. Our topic of discussion this morning is a common health condition that is peculiar to many people. Some people know they have this issue, while some people don't even know they have it, or they don't really want to admit that they have it. What are we talking about? It's called bad breath, medically known as halitosis. Joining us on the program to discuss halitosis this morning is a maxillofacial surgeon, Dr. Oluwarotimi Akombi Clement. You're welcome on Health Business.
Thank you very much, madam.
So what exactly is halitosis and what are the causes?
Well, before even talking about causes of halitosis, we need to even let the population know about what halitosis is really all about. We're talking about bad breath. Talking about when you talk and whatever coming out of your mouth is not really pleasant, and there's a way the person you are talking to want to express that, either by touching their nose, trying to move away from you. That is basically, showing the signal that the breath coming from your mouth is not too pleasant. That is what we mean by halitosis in the literal sense of it. Then coming back to the causes now, we have what we call the extrinsic causes and the intrinsic causes. Talking about the extrinsic is an inbuilt thing that really you may not really have an input per se, but you need to investigate and really know what that is. And then extrinsic has to do with what you've taken in that eventually is now leading to that. For example, talking about the extrinsic now, the food we eat, the moment you finish that food, the things and the odor that comes from our mouth will definitely be close to the flavor or the odor of that food. That's an example of extrinsic. But if you have perhaps you have what we call upper respiratory tract infection, or somebody with pneumonia, that is really intrinsic, in that you have a pathology with inside that individual which has to be taken care of or be treated. So talking about the cause, and basically in this part of the world, the oral hygiene status is also very, very important. If you've not been brushing your mouth, when we talk about taking care of one's mouth, you could be brushing even twice a day and you're not doing it the way you ought to. That will allow some food debris to be in your mouth, which eventually will make your mouth to smell. Much more than that. For example, even the way you brush or your food intake, like having cavities on some of your teeth. Those cavities, when they become big, widened, they tend to accommodate some of our food debris too, which bacteria in our mouth will act on, and that also will lead to some forms of bad breath. So diseases.
Are there some health conditions that can predispose one to having halitosis?
Oh, there are a lot of health issues that could really predispose one to bad breath. So, for example, some like end stage of kidney diseases. So even you have diabetes mellitus. Of course, as I've said, they tend to produce a lot of ketones, which takes over their sweat. They could perceive it in their breath, and even when they talk to you, what comes out of the air that comes from their mouth, all that will not be too good. And then some foods also, those that indulge, I won't say indulge, maybe you take a lot of spices, especially that's why those from the Orientals, from the eastern part of the world, you see them because they have a lot of spices in their food. They tend, when they talk, the odor that will perceive from them is not something some of us can really live with. So talking about medical condition, diabetes mellitus, even some people with oral tumors, different kinds of swelling in the mouth, if it's not well taken care of, even when you have dental-alveolar abscess, before you know it, pus will be coming out from your mouth. Of course, what kind of perception do you expect from somebody having pus coming out from his or her mouth? So there are so many medical conditions that can predispose one to halitosis. But the baseline of it is that you don't need to wait. Or when you yourself, there's a way you could even, there are very, very domesticated things that you can do to even know if it may not be too scientific in its real sense of it, but you yourself will know. For example, almost all of us will have bad breath when we wake up from sleep in the morning. But it's expected that that individual that follows our rule, in that brushes the last thing he or she will do at the end of the day, such a one, when he wakes up in the morning, the halitosis will not, in fact, it may not even be there, or it won't be as bad as somebody who did not even wash or clean his or her mouth as the last thing before going to bed. So with that, there are medical conditions, but there's also a way you also can know that you have bad breath. Simply just place your hand very close to your mouth, and whatever breath coming from your mouth, definitely your hand will push it towards your nose. You can really tell if it is really bad or it is clean.
What category of people are predisposed to halitosis?
There is no age range. As long as that mouth is there, you wonder, why am I talking like this? That's why we always say that you don't have to wait until a particular age before you expose your child to dental checkup. The moment, well, if the teeth are not there and it's only first 6 months of life, after that 6 months, you see the milk teeth, from the lower one coming out. As long as those teeth are there, the mouth do inhabit microorganisms, and when those microorganisms, we call them normal commensals, they don't cause any harm in our mouth. But as long as there are things they can act on, definitely the product of acting on those things in our mouth will definitely bring odor that may not be too good to our perception. So as long as you have teeth in the mouth, halitosis or bad breath can occur in the mouth. So talking about age range, you see that it's really, really, really wide.
Okay. I will know all that facts now. Let's now move to the management of halitosis. What is the procedure like?
The procedure, basically, I would say that don't indulge yourself in trying to treat yourself. Even talking about oral hygiene status is also important, as long as that child, that individual, has teeth in that mouth. We've advocated several, and we'll still continue to do that as long as we don't have any new invention or new therapy as to that. Every six months is important, very, very imperative for every one of us to do our normal dental checkup, so that those predisposing factors will be taken care of. Even in a dental clinic, we've had what we call as dental findings. Somebody comes into our clinic and will tell us that not even bad breath now, almost all my teeth, they are shaking, and you wonder, and when you look at the individual or the patient's mouth, the oral hygiene is not really that bad. So what could have caused almost all 5, 6, 7 teeth, they are shaking, the 1 or 2 degree mobility. Of course, there are telltale signs of some diseases, especially diabetes mellitus. We just tell them to go and do their fasting blood sugar, or even random blood sugar, which you can even do on our chair side if we have the kits at that very point in time. And you discover with blood sugar, normally it's between 70 and 100, 110 thereabout. But now I'm talking about kilogram per DL now. I now have somebody with 210, 300, some even 400. Such ones, they are working cups. Of course, such ones will definitely come down with halitosis. What I'm going is that you need to come for dental checkup regularly. Even if you have that case, you cannot solve it yourself. Even if you brush regularly, you still need to come for that dental checkup. And with that, there are basic treatments we'll start with. And by the time we do all that, hopefully the halitosis will stop. So talking about management, visit your dentist. When we examine you, carry out 1 or 2 investigations, we'll be able to tell you the underlying cause, and we'll give you different causes with different line of management.
So will you say the treatment is a one-off or a continuous one?
But it's not one-off in any form, in any way. It's even well, we're not talking about treatment of halitosis now, but it's for a lifetime. Because as long as you have your mouth, and we have said that the mouth is a gateway to the whole body. When your mouth is healthy, you can rest assured that your whole body is healthy. In fact, most of the debilitating diseases, non-communicable diseases that we have now, tend to manifest early in the mouth. And that is for those who are experienced dental surgeons, they tend to pick that and quickly, inform the patient to go after that. So it's not a one-off thing. And as long as you want to make your mouth to be fit, you want to have good oral health status, when you come in, those basic dental treatments will give you, will always keep, if there are no underlying medical condition, will always keep your mouth fit and will make you free from any form of halitosis.
All right, coming to my last question now. What are the best ways to practice good oral health hygiene?
It's very simple, clear, and very, very straightforward. But what I've discovered in this part of the world is as long as there is no pain, we tend to ignore most of our crusade. But I want to say that either you pay for it now or later in life. What I've discovered, my own experience in this job over 2 decades, I've discovered that if you don't pay as a young individual, even you pay, only very few percentage of our population tend to escape dental treatment. A colleague of mine, when we were in university together over 20 years ago, just called on me on Friday. Where am I? This is it. These were individuals that when you even talk about teeth treatment, you go and see that my teeth is very strong. Now he came down with a very strong toothache. And looking at it, there's even no obvious tooth cavity or hole, but the fact that he has neglected the normal routine dental check, you can imagine somebody who has not visited a dentist is close to 50, if not over 50, and coming down with one complaint or the other. Ordinary simple scaling and polishing will have solved the problem he had. Or if he had seen his dentist 6 months ago, a year ago, perhaps would have discovered that particular issue. So I'm trying to say that trying to take care of your teeth, the very first thing I would say is before you even do anything apart from the normal twice daily brushing, visit your dentist. Make sure you have a family dentist that you can send your complaints to every now and then, and that will really help. Of course, what will run the price is too expensive in this part of the world. The issue is there any gain without the price? Or even as common as our car is, we tend to service. If we neglect that car and use it for good 1 year without doing anything to you, you can imagine when it disgraces, when the car will disgrace. It's the same thing with our mouth. We need to do regular dental checkup every 6 months, much more than that. I would say reinforce this. You must brush your teeth twice daily. In the morning and the last thing, that's the key word. You can brush your teeth between 7 a.m. and 10 a.m. You have not followed that instruction. The last thing before you go to bed. If you have cause to eat, you still brush, because that is not the last thing before you go to bed. So brush twice daily, regular dental checkup, and watch your dietary advice. Is very, very important. This in between snacking, you need to stop it, because talking about tooth caries or having cavity on your teeth is not the quantity of sugar you take, because you tend to, that will be the discussion for another day. But if you engage yourself in sugary substances throughout the whole day for a long time, 1 month, 2 months, you end up having a lot of cavities on the surfaces of your tooth. So also your dietary habits also counts in this matter. So good dietary habits, good oral hygiene practice, visit your dentist regularly. I think one will stand free from halitosis.
In almost all what you said, you talk about brushing. Can you please demonstrate on how to brush properly?
Talking about where I'm to brush our teeth, for the lower teeth, what you do is take it this way, outside, very, very important. That's where you brush. Then you come in and you take it out that same way. It's not difficult. You can easily do that in the mouth, same way. Down. Down, then also the inside should be taken care of. Maybe just one or two horizontal stroke. You can do that. Then make sure you brush. I'm not saying you should scrub, but you should brush your tongue. With that, twice daily, you will be alright. Thank you.
Thank you so much, Dr. Olurotimi, for educating us on the causes and the management of halitosis. Next on the lineup is the pharmacy segment. Stay tuned.
Medicines are meant to do good by bringing relief to those suffering from one health condition or the other. But in the Nigerian environment, it appears medicines are no longer doing what they ought to do. In many cases, the conditions of the patients get worse, and some have even led to death. According to a foremost pharmaceutical body in the country, this happens when 1. Drugs are not available at the point of need. 2. It is available but not at the right time and quantity. 3. It is available as adulterated or as outright fake. 4. It is available and such can be accessed in or at wrong places. 5. It is available in the wrong hands and not handled by the experts. Registrar of the Nigerian Pharmacists Council Elijah Mohammed said distribution of drugs requires efficient supply chain systems and appropriate regulation to ensure that the medicines that reach the consumer are in their intended qualitative state, supported with the required infrastructure to ensure rational use.
The guidelines to maintain the integrity of this pathway is what is called the National Drug Distribution Guidelines that has been put in place by the federal government. And that guideline has 3 main objectives. The first one is to ensure efficient and effective drug supply to Nigerians. And then 2 is also to ensure the supply of high quality and affordable drug to Nigerians through the public and private sector, and then to ensure that all drugs in the national distribution system are well distributed, managed, and controlled by the relevant officials that are involved in maintaining the safety of drug in Nigeria.
Mohammed pointed out that in Nigeria, the drug distribution infrastructure is fragmented and inefficient, resulting in a preponderance of fake, adulterated, and substandard products infiltrating the market because of the activities of the unscrupulous elements.
We are pleading with all stakeholders to key into this new national drug distribution system that the government has put in place. But however, the sole point of the drug distribution in Nigeria is still the open drug market. And the government, in its wisdom, is tackling it. And the federal government has given all open drug market in the country 31st of December 2018 to move from where they are to a place we call the Coordinated Wholesale Center, which is a regulated environment where all of them will be. And from there, we should be able to checkmate the essence of the distribution of fake and adulterated drug in this country.
Although the federal government has commenced the implementation of the National Drug Distribution Guidelines, which took effect on the 1st of July 2017, stakeholders in the pharmaceutical sector are hopeful that this move will sanitize the drug distribution system in Nigeria.
It's now time to join Dr. Abayomi Ajayi on Understanding Infertility to address all your infertility issues. Please don't go away.
Now we're going to take them one by one, just like I said. Look at the tests that we can use before you even get pregnant. And this is one thing I want you to listen in our bodies. And most of us carry 3 to 5 genetic mutations. It's okay, no problem. We are carriers, okay? Now, but if you marry somebody who has the same genetic mutation, then there's problem. Because there's the likelihood that you now have a full-blown disease. That's why sometimes you see 2 black people suddenly come up with an albino. Because the 2 of them are carrying these genes recessively. And then the 2 of them come together, and what happens is an albino results. We call this compatibility genetic testing. We want to find out that you are not carrying the same recessive genes as your partner. Even if when you're already married, it's possible. But when we see that, that might mean that you have to progress doing some other procedures in order for your children not to come up with these disorders. See, some of these disorders are not life-threatening, and therefore, but they can reduce the quality of life. For example, what we call Down syndrome or Mongolism, So it's better to screen for all this before they come staring at you in the face. Now, there are other tests. You remember the other time I told you that when a man has very poor sperm count, then it's important for us to see that the sperm is not carrying any genetic defect, because we've seen that the poorer the sperm count or the poorer the sperm parameters, the more the likelihood that there will be chromosomal problems in the sperm. So the test that called sperm aneuploidy testing, which can look at what is the percentage of the sperm in the man that has any problem. You remember the word aneuploidy again is coming up again. So aneuploidy just means that there is error in the chromosomes. So the error in chromosomes can come as a result of structure, one thing being missing or something being present that is not supposed to be there, or the number. You remember that we said in a previous episode that there are 23 pairs of chromosomes. In some people, there is what we call trisomy. There are 3 chromosomes instead of 2. And in some people, what we call monosomy, there is 1 instead of 2. All these are abnormal. So it's possible for us to detect this even from the sperm, to see what percentage of the sperm is carrying an abnormality. And usually, the common chromosomes is what we test for in sperm aneuploidy testing. We look at chromosome 13, 18, 21, and then the X and Y chromosomes, or the sex chromosomes. So, but also we can do, which is what I really want us to focus on, we can, during IVF treatment, before now, the only way we could test that is when this coronary villus biopsy, which of course we know that can rarely but can lead to pregnancy loss. You can lose the pregnancy, and also amniocentesis. But now, life has become so interesting and so easy that we can do what we call non-invasive prenatal testing, which just involves taking the blood sample from the mother, and we're able to see the free DNA from the baby in the mother's blood sample. And this we can do from 10 weeks. And this is been shown to be as sensitive as chorionic villus biopsy. Yes, we might have to follow up with scans as the baby is developing, but this is very good. This is good enough for us to be able to see that the pregnancy is not affected by any chromosomal problems. And also, of course, like we said earlier on, another test that we can do is even for people who have lost their pregnancy, we can see whether there is any chromosomal abnormality, what we call product of conception testing. So we can just take a part of the placenta and send it for testing, and we're able to see whether the baby or the babies were affected by chromosomal abnormalities. You must agree with me that life has become a lot more interesting than it was a few years ago. So it's at this point that I'm going to end this program today. I hope I've been able to pass one or two things to you at home. My name is Dr. Bayomi Ajayi. Cheers.
We've come to the end of today's package. The program is Health Business, and my name is Oluwatoyin Kolaole. You can be part of this program by calling the numbers showing on your screen. Remember, living healthy is a serious business. Bye for now. Thank you.